Okay. Well, good afternoon. We'll call the press briefing to order, I guess. And Joe McComb, Mayor of Corpus Christi. We're glad for you to join us today on September the 15th. Dr. Byrd will be here momentarily with his report to give us an update on how we're doing. And Annette Rodriguez will be making a presentation and giving some information to the public. City Manager Peter Zanoni has a schedule conflict and won't be with us today, but that doesn't mean he's not out working hard for us. And so we appreciate that. But we'll get started because Annette has got her report and then has got a guest with her that she'll introduce and explain that report. So if we'll get started then if Annette is ready. And we thank you for coming. We trust that everyone is continuing to practice the safe practices that we've recommended. And we're making progress a little bit at a time, but you know, every little bit helps. So we thank you for that. And at this point, I'll turn it over to Annette for her report. And then Dr. Byrd will give us the statistical analysis and the report from Texas A&M, Corpus Christi. So, Annette.
El día de hoy vamos a tener el reporte por parte de la Universidad Texas A&M, así como la directora del Departamento de Salud Pública, mientras que el administrador de la ciudad no va a estar aquí el día de hoy.
Annette Rodriguez, Public Health Director. I'm going to go over our numbers, the number of cases of COVID-19 today. So our cases today are 75 cases. Yesterday they were 44, and the day before they were 24. So that's a continual increase in the numbers, and that's not what we're looking for. We're looking for a continual decrease of the numbers. So we need to just be vigilant in all the things that we've been talking about, the public health strategies. So you don't see the slide up yet, but I'm sure they're getting them up. The next slide basically just shows that there's some cases from the state. And so we go back and we put those cases in the right dates, if you will. So a lot of them are older than the last 2 weeks, but we put them in the right places so that way we can look at the numbers to see if they're statistically significant. The next slide is basically, it just basically shows the bell curve, and it shows the blue at the bottom, which are the cases, and then it shows the THT cases on top. And you see the bell curve, and you see that we peaked probably around July 12th, 13th, 14th, somewhere in that vicinity. And now it looks like we're going down, but then we're kind of seeing these numbers kind of at the tail end here that are going up a little bit. So the next slide is the donut slide. And what you see on there, if you could see it, and I apologize again, but you would see that we have over 18,000 individuals that have recovered. We have 397 deaths, and we have 640 active cases. So, and that's a really good thing, is to have the 640 active cases, because we want to get those numbers, you know, way down into the single digits and then into the into zero if at all possible. So that's the goal before flu season that starts October 1st. And there's the donut shape that we just discussed. 18,808 recovered, 640 active cases, 397 deaths. The next slide shows the hospitalizations, and again, you see the trend, that it's a downward trend. So from 136 on the opposite side of the graph to 91. But you do see that you were at 78 here, and over the last couple of days, it's kind of wobbled and it's kind of creeping back up there. So we have to really watch these numbers very carefully. The next slide. The next slide shows the ICU patients, and you see from 5861, and you see it at 29. And we do know that some of these individuals will recover, but we also do know that we lose people to COVID-19 every day. The next slide is the 397 deaths that we're at as of today. And the final slide is going to show the 7-day average. And if you look at it, again, you see the bell-shaped curve there, and you see the numbers coming way down. So, and we need them to be completely flat, like they were at one time, when we started into this pandemic. So I'm going to change hats for a minute, and I want to talk about the news briefing that we sent out earlier today. And then I'm going to turn it over to Dr. Ram. So in early July, the health district received notification of a baby that was less than 6 months old, and they were diagnosed with COVID-19. About a week after the diagnosis, the baby was picked up by EMS at his home, and the baby was unresponsive. Unfortunately, the baby was not able to be resuscitated and later passed away. Due to the infant being unresponsive at home, an autopsy was ordered to discover the cause of death. At that time, the health district informed the community that we would notify the public what the cause of death was in such a small infant once we received that final report. The health district has now received the medical examiner's final report, and Dr. Ramachandrani, our local health authority, will give us the medical details. I'll now ask Dr. Ram to come up and give us more information on that case. Thank you.
En las últimas 24 horas se han reportado 75 casos confirmados por el coronavirus. Los casos positivos han tenido un leve aumento en los últimos 3 días, por lo que le pedimos que continúe haciendo de su parte para que esos continúen disminuyendo. Actualmente existen 18,808 pacientes que se han recuperado por completo. 91 personas continúan en el hospital. 29 están en la unidad de cuidados intensivos. 640 personas continúan aún como casos activos. El día de hoy se reporta un fallecimiento. A la fecha, los fallecimientos totalizan 397 personas. A principios del mes de julio, el Departamento de Salud recibió información de un bebé menor de 6 meses de edad quien tenía el COVID. Posteriormente, el bebé perdió la vida. Nosotros le indicamos que en cuanto tuviéramos esa información, se la daríamos a conocer. Ahora el doctor Ramachandrani nos va a dar la información sobre la autopsia practicada al bebé.
Hi, good evening, everyone. So I'm here to give you an update on the autopsy results sent to us by the medical examiner's office. The baby presented at Driscoll's emergency room back on June 30th with fever and congestion, and he was found positive for COVID-19, and there was some urinary tract infection, and even the adenovirus in the respiratory samples were positive. So the baby was treated with antibiotics. He responded well and was discharged home in a few days. And at home, approximately a week later, 911 was contacted by the baby's family and reported their baby was unresponsive. So the baby was not able to be resuscitated, and the baby was later pronounced dead. The autopsy from the medical examiner office reveals that this is a 6-week-old baby, and the cause of death to be from the medical complications of COVID-19 viral infection, and bronchopneumonia listed as other significant condition. On the postmortem examination by the medical examiner, they found microscopic blood clots in the lungs, spleen, and pancreas consistent with COVID-19 complications widely reported in the literature. And the baby boy tested negative for COVID-19 postmortem but given the novelty of this virus, there is a limited information on the postmortem viral molecular testing at this time to know if this is significant. And our deepest condolences to our family, and I'll be available to the family, and I will be available for any questions. And before I go further, there is a flu season that is here. I want everyone to get a flu shot, and also it's important to give a jolt to our immunity around this season, and it might help us with the COVID situation also. And also about the mask, there was an interesting theory in Reputed Journal. I want to bring it out at this point because the masks, if you wear a mask, the amount of viral particles deposited in the nasal passage will be very few, and it takes longer for the viral particles to multiply, so you will get less severe infection. So I encourage and urge everybody to wear masks also. Thank you. I'll be available for any questions. Okay.
Thank you for your time. There are a lot of parents who do have younger children, and some of them aren't able to wear masks. And even though this is advice, this is another. Okay, good. What advice do you have for parents who are kind of scrambling during this time of the pandemic and don't want to replicate something where their child does die of symptoms related to COVID-19?
Well, this is a very important question. Everybody is worried, and I'm a parent myself. I'm worried too. But again, if you practice, the plan that we have for schools, and if you wear a mask and wash your hands frequently, it can mitigate the risk. And as I said just now, if you wear a mask, the idea is not just for figurative that you wear a mask, but the theory that was proposed is you'll get a very few viral particles deposited, you'll get a very less severe infection. So that might help in the overall situation. Again, the winter season is also coming over, so I think it's important for us to keep, the safe practices going forward. I think then we'll have a safe winter, going forward.
In instances like this, do you believe newborns, childs who are 6 weeks, maybe even younger, older than that, should they not be in public situations where they're exposed to people?
Well, we have only very few cases in the world that infants are at risk for this kind of COVID situation. In fact, I reviewed the literature just before coming here. I could see only maybe 3 or 4 instances in the United States about 6 weeks old babies or around a few years old. But there are not that many complications arising from COVID in younger children population. So I think it's safe to assume that as long as we do the safe mask practices and safe, hand washing and everything, I think we should be able to ward off the situation.
Last question.
Yeah.
Nueces County, we've kind of been put on the map just because the amount of children, young babies who are diagnosed with COVID-19, having these symptoms. Do you believe that, knowing that changes our direction in any regards?
I don't think so. As I said, I think we have good plan in place, and everybody is following. As I see, everybody's wearing masks these days. Everybody's following safe distances. I don't think we need to do anything more drastic. I think we're doing the best we can going forward. But the most important thing, as I mentioned, is have a flu shot in this winter season. And the winter is going to be tough because the coronavirus, especially, just like any other respiratory virus, lingers longer in the winter season. So it's especially important that around this time to be more vigilant and to be more careful about these things. Masks are not something that you can ignore or take it easy in the schools. And, I see the teenagers don't wear masks, which is probably dangerous. Even I tell my kids to wear masks all the time, and I hope they listen, even at the school. And that's all we can practice safe, these things, with mask and everything. I think that will help us going forward. And flu shot definitely will help us, because you don't want to confuse the situation right now with the fever, all the symptoms that are overlapping with the COVID. The flu symptoms overlap with the COVID. And so that will kind of create a little chaotic situation. So it's better to have the flu taken out of this equation. So everyone should get a flu shot, in other words. And I think we have flu shot available right now at Health Department. So anybody can come and get it.
Okay.
All right.
Thank you.
Thank you.
Very far, because I think they're going to ask you. I just want to add one point to that, is that babies, we all know that when an infant is born, they are a vulnerable population. They don't have all their antibodies, they don't have all their immunities built up yet, and so we need to take special care of these babies. So one of the things that you can do, and we've been messaging this same message, is to leave the baby at home, if at all possible. If the baby can stay home, leave them home. If you do have to take them out, because I've heard that conversation as well from single parents, they have to take them, they don't have anybody to leave them with, then just make sure that you're protecting them, you're social distancing from other people, and that you're keeping them covered if at all possible. We've all seen the strollers where they put like a blanket over it, but make sure you're paying attention to the baby as well, because it can get very, very hot with blankets on top of these strollers. So I just wanted to add that. So if there's other questions, Dr. Ram's available. If not, we can go. Are there other questions?
Can you talk about the process of how autopsies like this are handled, the timeline of it, and why it could take a few weeks to get the final results back?
Well, this is a unique situation with the COVID. The classic findings in the autopsy they need to verify, and probably they need to confirm with state health authorities, and to be certain that what we're doing and what we're reporting, it is because of the COVID, is very important, because COVID has, the literature keeps changing. And the widely known fact is we see the small blood clots in the multiple blood vessels. And in this particular baby, we saw the blood clots in the lungs and in the spleen, very characteristic of the COVID. And we see that very common. Without having respiratory issues, people come with blood clots. They get dead bowels, because there is no blood supply to the bowels. And then they get strokes. So all these things, these are evolving. And back in June, I think the timeline of it is also we need to make sure we have to be safe with the autopsy, with the COVID situation. So they need to take appropriate precautions and test the samples. And you have to test every pathology sample from each and every organ tissue, and verify it whether it is just because it is COVID or not, because the COVID PCR was negative in the postmortem situation. So it's kind of, we want to say it is COVID-related complication, but we also wanted to make sure it is not something because of any other bacterial infection, any other comorbidity that we cannot just say it's because of COVID, just because the patient had COVID a few days ago. So I think that's why it took long. I think we have a very comprehensive report that conclusively says it is because of the COVID-related complication. So I think that's why it took long. Yeah.
Did this child have any pre-existing conditions?
No, not that we know of.
You suggested that now is the time to get flu shots. I believe you have to be at least 6 months old. Would you recommend that for within all age groups?
6-month-old is what we're recommending right now. 6-month-old and above, right? Yeah.
Okay.
Yeah.
Thanks.
Anybody else? That's it. Right.
So as Dr. Ram mentioned, this baby is one of the youngest COVID-19 related deaths in our country. The Health District continues to strongly recommend the use of preventive tools to stop the spread of COVID-19 infection. The prevention tools include the 3 W's, wearing a mask, watch your distance, and always wash your hands as often as possible for at least 20 seconds. I will now turn it over back to Gabby, and then she will turn it over to Dr. Bird. Thank you.
De acuerdo a la autopsia practicada al bebé, él tenía fiebre y otras complicaciones o afecciones médicas, así como el coronavirus. El bebé fue atendido con antibióticos y respondió bien. Una semana después, el bebé fue llevado al hospital, pero falleció. De acuerdo a la autopsia practicada al bebé, el bebé murió debido a las complicaciones por el coronavirus. El bebé también contaba con bronconeumonía y también se le encontraron varios coágulos de sangre. Nuestras condolencias para todos sus familiares. El doctor Ram también le quiere recordar a la gente que se encuentra ya cerca la época del flu, por lo que es importante estar vacunado. El uso de cubrebocas también le va a ayudar a prevenir contagiarse con el virus del flu. Ahora el reporte por parte del doctor Chris Bird, quien nos va a dar el reporte por parte del equipo especial de la Universidad Texas A&M.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID Task Force. We redesigned the slides so that they wouldn't get covered over by the interpreter. So for the people that are projecting this, you don't need to show me. You can just show the slide with the interpreter in the box, and that should be perfect. That'll be on each slide. We have 2 objectives on the task force. The first is to address public concerns about both COVID-19 and the interventions that are taking place to control the spread of COVID-19. And the second one is to enable evidence-based decision-making when it comes to things like opening schools for face-to-face and changing interventions that are in place. Right now, there's several interventions that are occurring to address the spread of COVID-19. One is stay at home if you can. And this doesn't mean that you have to stay inside all the time. What it means really is stay away from other people if you can. It's healthy to go outside and get some fresh air. 2, social distancing and face coverings are important. Face coverings help stop the spread of COVID-19 by both stopping you from infecting other people if you happen to have COVID-19, as well as reducing the chance that you'll contract COVID-19 from other people. Social distancing helps also. Although at this point we do know that COVID-19 is aerosolized, and what that means is that it can float in the air for long periods of time, and if you're in an enclosed room like right here, it's possible that it could linger around and go farther than 6 feet away. Everybody, I think at this point, or like most people know that I got COVID. There's only 3 possible places where I got it. This room was one of them. Moving forward, self-isolate when you're symptomatic. I became symptomatic, I self-isolated. Now, here's something that goes along with a flu shot. I got a flu shot 24 hours before I was symptomatic, and so I thought that I had the side effects of the flu shot. And if I didn't go and get tested, I wouldn't have known that I also had COVID after getting the flu shot. So if you get the flu shot and you become symptomatic, don't just assume that it was from the flu shot. It could be COVID. Self-isolate, then figure out what's going on. There's school restrictions in place. We're not back to full 100% face-to-face. There's limitations on how many students are in school at any one time. This is happening at K through 12. It's happening at Del Mar. It's happening at TAMU CC and TAMU K. So these restrictions continue to be in place. And we've gone through a series of opening Texas after a really strong lockdown. Went through Open Texas Phase 1, Phase 2, Phase 3. Phase 3 lasted for a month, and from the end of that Open Texas Phase 3 month, we've been trying to get COVID-19 under control in Texas ever since. So for 1 month of Open Texas Phase 3, we're at well over 2 months of trying to get COVID under control now after that 1 month of Open Texas Phase 3. 3 was repealed a week later. 2 was partially rolled back, and now we're in what I call Open Texas 1.5. We have gone to a little bit more schooling, so we're kind of moving up towards 2 again. But that's about where we are. In terms of our transmission rate, things are continuing to look better from week to week. And so our transmission rate right now is estimated to be 0.9 with both models that we use to estimate the transmission rate. One of the model outputs you can see right here, what you see over there on the vertical axis is the transmission rate. This is how many people on average get infected from a carrier. And so when we have 0.9, what that means is that there's a 90% chance that each person that gets COVID is going to pass it on to one more person. And we can see this line at 1 is that tipping point between decline and increase. And so 0.9 is good, it could be better, and if we go above 1.0, then we expect that COVID would start spreading again. And you can see that we're kind of oscillating around 1.0, but most of the time, given the particular day of the week, we're below 1. This map shows you a color-coded heat map of the state of Texas and the probability that the transmission rate is below 1. And you can see the whole state is blue for the most part. We're this light blue color, so there's about a 60 to 80% chance that the transmission rate is below 1 here in the coastal bend right now. And there's a couple areas where there's an 80 to 100% chance that the transmission rate is below 1. This is the best we've seen this map look in a long time, so hopefully this continues. The next slide shows the total number of confirmed cases. And I want to make sure everybody understands that confirmed cases are cases that were confirmed using the PCR test. This is the gold standard test that tests for the presence of COVID-19, and it's different than a probable positive. So these numbers are slightly reduced for the coastal bend compared to what it would be if we included probables also. But we have 22,641 confirmed cases of COVID in the coastal bend area with 21,063 recoveries. These recoveries, they're calculated algorithmically at this point because there's too many cases to keep track of individually for the recoveries. In terms of active cases, we've seen a slow and steady decline, which we expect to continue, and we're down to 1,014 active cases right now in the coastal bend area. In terms of our rankings, there's been a big change in this plot this week. Normally, we've been ranking in the top 4 or 5 in Texas, and this week we're down to all the way almost last place, which is exactly where we want to be in terms of number of new cases per day, per capita in the coastal bend area. So this is a large drop. I went and checked the numbers, I confirmed it. It's legitimate. There's not a mistake on our part in terms of the code that we use to calculate these values. So this is a positive development. Hopefully we stay down there. Here's a look at the new cases per day over the whole coastal bend area broken down by county. Each line is a different county on the plot, and you can see NUECES is dominating. And this starts at the beginning of the current outbreak, which was at the beginning of June, and then goes through the present day. Now it's hard to see what's happening right now, and so we're going to zoom in on this. I want to key you in on this data dump that occurred last week that we saw kind of going up. It's come back down again, so we're confirming that there was a data dump. So now you see it over there on the left-hand side of the screen. We've just zoomed in on the same plot, and you can see that right now there's more cases per day, new cases per day in NUECES than the other counties in the coastal bend, but it is trending upward somewhat slightly. And so we're watching this right now cautiously and wondering, is this the Labor Day COVID bump that we've been expecting to maybe see? Right now, I think it's too soon to tell. And you could just back up a week and a half and see that we went through a little bump up before that really had no correlation with anything. And so next week, we'll know for sure whether this was a Labor Day bump or just random noise in the data set. Jim Wells and B County are pretty close to NUECES in terms of new cases per day. And this is not per capita, it's just straight up new cases. And so that's, given their much smaller population sizes, it's a little bit concerning for those counties. When we look at the percent positive tests, I've been showing this graph for the past several weeks. When we plot this out, the points represent particular days with the proportion of positives. With these two data sources, the local public health department testing and the mobile testing stations, we know how many people tested positive, which we know with all the tests, but we also know how many people tested negative, which we don't always know. And so that's why I like to show this, and we get a percent positive rate for today of 11% estimated for the mobile testing station and 2% for the public health department. So these are moving in the right direction. They're coming down. You can see that trend. Now, what you see in the newspaper, or you see on cctexas.com, that's a calculation of the percent positive over the whole pandemic, not an estimate of today. Now, we're going to transition to a new version of this graph. And because there's so many additional points, I've removed them so they don't confuse anybody. And now we just have 3 ribbons. These 2 ribbons are the same. They're right there, the mustard color and the gray. Now we've added a blue ribbon, which is all the testing data that we have. Now we don't know all the people that tested negative, and so you expect to see a little bit of an elevated percent positive rate for that. But it kind of shows you not just 2 subsamples of the data set, but also the whole sample. So 18% are testing positive on average up through today. And then 11% and 2% like we saw in the last slide, and then our overall percent positives through the whole pandemic can be seen over here on the right under overall. We're at from 21 to 42%, depending upon which one of these data sources that you look at. And just so I'm very clear, the local public health department in mustard and the mobile testing in gray are included within all testing, and all testing includes several other data sources. So overall, we're trending down. There's a little bit of an uptick on the percent positives overall. We'll keep an eye on that and see how that develops. Okay, for hospitalizations moving forward, again, we're ranking in the top 5 in the state, which is not where we want to be. There's been a slow decline in hospitalizations nonetheless, even though we're still ranking high. And so we hope that this trend continues downwards. Here's the plot with each point is the number of people in the hospital on a given day from the beginning of this current outbreak to present. Right now, today, there's 112 people, at least at the last time I got data. There's 112 people in hospitals in the Coastal Bend that have COVID-19. And the ribbon and the line are the model projections. We haven't changed the parameterization of this model for a month and a half. So a month and a half ago, we predicted basically pretty accurately the amount of people in the hospital right up through today, and we expect that that will continue. We projected out for 2 more weeks, and we expect that it's going to go below 100 within the next week, 100 people in the hospitals in the Coastal Bend with COVID, as long as things continue on the same track. Now, what will cause this to change? The reason why it's been so consistent is because our interventions have been very consistent, and everybody in the community has been very vigilant about wearing their masks. This projection is going to change when we change. If we change how often we're wearing masks, we change our behavior. If restrictions change and interventions change, then this projection will change. And if we make them more stringent, then the projection will overshoot the number of people in the hospital, and if we roll back like we have in the past, then we'll undershoot, and then we expect the number of cases will start to increase. For the ICU, this is really what we're concerned about with hospitals, because the ICU was the part of the hospital that was the most affected by the COVID surge over the summer, and right now we're still stretched. You see there's 32 people in the ICU in the Coastal Bend area right now. You can look back in May and June, at the beginning of June, and see what the normal amount of people in the ICU is. It's somewhere around 145 or so. And today, or on the last data download that I have, there's 145 people in the ICU, so that's a positive development. But 32 of them have COVID, and you have to not look at just one day, but you have to look at the average over time. You can see that we're still well above this average line of 145. So we're seeing continued decline, which is good, but the ICU is still stretched beyond what it would normally be. And so that means doctors and frontline workers that are working more than normal to try to make up for that difference. The more that we curb COVID right now, we'll hopefully be able to give them a break sometime in the not too distant future. Okay, in terms of fatalities, we're still ranking fairly high, even though the rate of fatalities or the number of fatalities per day is declining. So hopefully we can see a change in this like we did in the number of cases where we go down to last place in the state, which means the least number of fatalities. But right now we're still ranking fairly highly. Now the state changed the way that they count the fatalities more than a month ago at this point. We've transitioned over to just showing that method of counting the fatalities. The way it works is when people die, there's a death certificate, and there's a primary cause of death, and then there's additional secondary causes of death. If COVID was a primary cause of death, then these death certificates get counted, and these are being counted by the state. And so what happens, right, what happens is that for the most recent deaths, they're not counted yet. And that's why we see this really strong leveling off pattern. There's been 564 confirmed fatalities from COVID in the whole pandemic. And over the past week, this number's increased by over 50. So that's a 10% increase over last week. And we expect that it's going to increase more, even though there is an indication of leveling off. It's not leveling off that much because those death certificates haven't been counted yet. When we look at our model that's projecting what we expect for the number of new fatalities per day, each data point is the number of fatalities that occurred on a particular day. Those are with the circles. The triangles are ones that we don't think there's been enough time to count all the fatalities yet, so they're partially counted right now. And then the lines represent our model and the projection through to the present of where we expect things to go. So while the number of fatalities per day are declining, the model is predicting that it's going to start leveling off. Now, hopefully, we're going to end up on the bottom side of that model, but so far, it's been fairly accurate in the way that it's projecting, and we'll expect that that'll continue. All right, moving on to cell phones. We talk about cell phones because they tell us what's happening now. We're always 2 weeks behind this COVID thing when it comes to counting cases. If you get infected today, you might not know until 2 weeks from now. You might not show up as a statistic here until then. So the cell phone data gives us a look into the future, per se, when it comes to cases. So we can look at foot traffic, leaving home, potential encounters between different people, and see what's happening there. First, I'm going to show you the graph that shows where people are coming from to the coastal bend to eat in our restaurants, and then how many visits to restaurants there were on average from those people that are coming in from outside the coastal bend. There's a very slight increase this past week from the previous week, which you can see there in the last bar and the last blue bar in the table. And that includes the Saturday of Labor Day weekend, which is the Saturday of any holiday weekend that I've seen thus far. That's when all the activity occurs. So it's not Labor Day, it's going to be the Saturday before, and it's not Memorial Day. If you look at the first bar on the table, it's the Saturday before. So that first bar on the table includes the Saturday before Memorial Day, and you can make this comparison of the amount of visits to restaurants from people outside the coastal bend, and it's dramatically less, about half as much or even less than half as much visits to restaurants over Labor Day as compared to Memorial Day. So we didn't see the same sort of activity on Labor Day as we did at Memorial Day, which kind of marks the beginning of when this present outbreak started. Moving on, I'm only showing the graphs here that really show a change because we're trying to keep these presentations a little bit shorter. There's been a fairly marked increase in the amount of people leaving home since remote schooling started again. I don't know if that's causal or not, but it's a pattern that's there in the data. At the same time, the distance traveled has decreased. I'm fairly confident that the distance traveling per person decreasing is related to school starting again because people are less likely to go on trips. They're more likely to stay near home. And so that's a pattern that we're seeing. And just in case you're wondering, like, how good does the cell phone data work, you can see that there was a very low amount of distance traveled during Hurricane Hannah. On this graph, it's the lowest amount of travel that we've seen. And just to calibrate you again, 100 means normal, and that would be calibrated to normal before the pandemic started. If we're back up to 100, which we are close to on leaving home, that's about how many people were leaving home in February before the pandemic started. The other kind of good news here is potential encounters continue to decline, and this pattern really seemed to start when the remote schooling started. If you look at the blue, the bright blue, that's Fridays and Saturdays. And you can see the last high amount of encounters that we saw, which is 2 cell phones coming near each other, essentially. The more cell phones that come near each other, the higher the encounter rate. That's the last time we see this 100% of normal in terms of number of encounters. Since then, activity on the weekends, Fridays and Saturdays, is declining, but also on Mondays through Thursdays, we're seeing a decline in the amount of encounters also. And it even starts before remote schooling, so I'm not sure what else maybe contributed to that, but it doesn't seem to be non-random, and normally this is the type of metric that's been going up as the cases come down, not the other way, because we kind of want to go out and do more things than we did before. So this is a good sign. Declining encounters will correlate with declining transmission, which means less COVID. Also, we have our comparison, Memorial Day weekend to Labor Day weekend. And what you can see here is that we didn't see nearly the type of activity over Labor Day weekend that we did over Memorial Day weekend, and so we have less expectation that there's going to be some sort of serious bump that was caused by Labor Day. Now, the difference between these two, though, and I want to point this out, is that there were many, many, many fewer cases of COVID in the Coastal Bend area during Memorial Day weekend. And so it's kind of like how much fire is already burning when the conditions become good for fire to spread. If you have a lot less fire, like we did on Memorial Day, then it's less likely to spread. There's more fire on Labor Day weekend because more people had COVID. And so even though there's less activity, there's more people that could have spread COVID. So we're not sure how that's going to play out yet. School foot traffic for K through 12 is leveled. You can see that in the bright blue. For universities, it's continuing to go up. Which universities? TAMU CC, TAMU K, UTMSI. Those are the primary universities that are included here. And we're up to about 50% of foot traffic. I'm talking to people at the university while I haven't been there because I've been in quarantine. We're trying to understand why the foot traffic is at 50%, because at least some people I've talked to indicate that they don't really see that happening. So we'll dig into that a little bit more. Professional and technical schools seem to be about level right now. We'll see if that trend continues. It shouldn't go to 100% because we're kind of keyed in on February where schools were open, and there was certainly a lot more activity going on campuses and at K through 12 during February than are now. So in summary, the Texas-wide outbreak, it's not over yet. It's still occurring. We may be on the backside of it and getting down to reasonably low numbers again, but there's still double-digit numbers of new cases per day. And I recall at Memorial Day, it was very rare to have double-digit number of cases any one day, and we even had a 0 in that week leading up to Memorial Day. So this outbreak, it's not over yet. The COVID-19 cases are declining in the Coastal Bend. The ICU usage and fatalities are declining. That being said, the ICU is still slightly stretched and hopefully will continue to alleviate the pressure there. The return to remote schooling seems to be associated with a decline in transmission rate. So that's an unforeseen, maybe positive consequence of remote schooling. And then the transmission rate right now looks to be solidly below 1. And that's really the first time we've been able to say that with certainty for a little while, given the 2 models we're using. But given our continued decline, it makes sense that we've been slightly below 1. That being said, it's not time to relax here. It's not time to try to go back to normal. I think everybody is starting to realize that we're in a new normal, and the new normal is that we can't do what we were doing in Open Texas Phase 3 that led to the whole summer kind of evaporating on us and leading to where we are now, still trying to make up for that. So that's the presentation. We'll have a translation and then take some questions from Facebook.
Le queremos recordar que este reporte está basado en información de 12 condados del área y no solamente en el condado de Nueces. Continúan vigentes las intervenciones no farmacéuticas en el estado para así aminorar el riesgo de contagio. El radio de transmisión ha disminuido al 0.9%, lo que significa que una persona infectada tiene el 90% de posibilidad de infectar a otra. En el área de la costa, en la cual cuenta con 12 condados, existe a la fecha 22.641 casos confirmados por el coronavirus. A nivel estatal, el área de la costa ha bajado de manera significativa a la posición 21 en cuanto a casos positivos, lo que es muy buena noticia. En cuanto a hospitalizaciones, el área de la costa se encuentra en el 5º lugar. Actualmente, 112 personas están en hospitales diagnosticados con el coronavirus. 32 pacientes se encuentran en cuidados intensivos. En cuanto a fallecimientos, el área de la costa permanece en 3er lugar. 564 fallecimientos han sido reportados en el área, fallecimientos que cuentan con un certificado de defunción. Esos certificados de defunción pudieran tardar hasta 2 semanas en ser reportados con el Estado. En cuanto a encuentros entre personas basado en localizadores por celulares, la última semana de agosto se reportaron 49.774 visitantes en nuestra área, tan solo en restaurantes. Esta cifra es mucho más baja comparada al fin de semana feriado por el Día de los Caídos o Memorial Day. El número de personas que salen de su hogar también ha aumentado, posiblemente por el regreso a clases. Recuerde, entre menos encuentros entre personas haya, menor será el riesgo de infección y sobre todo de contagio.
Thank you. Dr. Edwards.
Okay, we have a few questions from the Facebook users today. The first question, maybe a question for Dr. Ram if he'd like to answer that question. So,
So what's the question, sir?
the question is, how effective are the flu shots this year?
Sure, it's pretty effective. They have good strain. I mean, any flu shot is expected to work for the next 6 months. So I'm 100% positive it's very effective.
Okay, and while you're still up there, is there any new data about how long someone is immune after they recover from COVID?
Usually 6 months. Oh, immune
Yes,
from the COVID.
yes.
Oh, okay, so we don't have any particular data right now. So, as I said, and this question was brought up several times before, the COVID infections, how long they're going to be immune. So far, the data have shown up till 4 months they have antibodies, but that doesn't mean that the antibodies won't last longer because we don't have enough data to support how long, because it's just been there around the corner, 6 months ago, this infection showed up. So more studies are needed, but if you look at the previous coronavirus infections, its cousins, the other 4 coronaviruses, the immunity lasts a little longer, like for 2 years at least. And even if you get a second COVID infection, let's say if you're exposed to it, the antibodies are supposed to protect that, and the severity will be much less. So in other words, I haven't seen any new COVID infections, recurrent COVID infections at this time.
Okay. And lastly, for you would be the incubation period for COVID. How long is that typically?
Usually typically it's between 2 to 14 days is what they say, but the symptoms to appear, it's anywhere between 6 and 8 days. Okay. The symptoms to start showing up, pretty much.
All right. And the next question may be an Annette question. How far behind are the death certificates? And does the 14 days mean county or mean that the county won't know about the deaths for 2 weeks?
So the death certificates usually have like a 10-day lag, and that's allowed for the death certificate to get filled out properly by the funeral home. And so you're always going to, see that the deaths that we're reporting are going to be higher than the death certificates that the state is reporting because they're waiting on the death certificate. Even like the death certificate for this little one we were talking about today, the 6-week-old, it was more than the 2 weeks because, the infant was still at the medical examiner's office.
Something that we should emphasize is that when the public health director announces a fatality, She's announcing that before the state counts the death certificate. So it's not like we're going to find out about new fatalities later. It's that the state is not recording them in their official database till later.
Until they get the official report.
For
That's
us to
correct.
give a report for the coastal bend, we only get data directly from NUECES. The rest of the data that we get for the rest of the coastal bend comes from the state. And so that's why we use the state's record of the fatalities with the task force, as opposed to what's reported in the newspapers each day and by the public health director.
Thank you. I also wanted to mention, you asked the question to Dr. Ram about the efficacy of the flu vaccine. And that we're working with CDC very closely. It depends on which vaccine they receive. There's different flu vaccines. There's the quadrivalent, which covers 2 flu A's and 2 flu B's. And there's the flu block, which has much more antigen to try to give you more protection. There's also the vaccine for the older population that has a lot more coverage. So what normally happens as we start seeing flu develop right prior to flu season, like we're seeing now, we've had like 6 cases reported so far, mostly all flu B, but we have had one that's flu A, and that's a typical flu season. You see flu B before you see flu A, and then you'll see flu B again at the end of flu season. And so CDC actually is looking at all these numbers, and they're also asking, how many of these individuals were vaccinated. And then towards the middle of flu season is when they usually will give you a determination that says it's this % effective. So last year, I think they were saying it was between 30–40% effective, the flu vaccine for that particular season. So we'll see that same kind of, report as time progresses.
And a question for you, Annette. Where can I get a COVID test with a fairly quick turnaround?
So, well, the health department, we're doing COVID testing tomorrow. So if you call, we can get you in, especially if you are symptomatic. If you're asymptomatic, the state is still doing testing in our community, either at the Richard Borcher Fairgrounds, sometimes at the Memorial Hospital. But if you call the 826-7200, we can give you that information as well to get you signed up. And they seem to have a fairly fast turnaround time now of about 2 to 3 days.
Okay, thank you. And this may be a question for you and Chris. How did we go from 2,500 active cases on the 13th to 542 cases on the 14th?
Yeah, can you repeat the numbers?
How did we go from 2,500 active cases on the 13th to 542 on the 14th?
Oh, okay. That was because we started instituting a formula instead of what we were actually doing for recoveries, is we were actually calling the individuals to find out if they were recovered. So the recovered period is about 10 days. On day 11, they're considered recovered if they haven't had any additional symptoms. Their symptoms are improving and they haven't had fever for at least the last 24 hours without taking fever-reducing medication. The region actually went to a formula system where the formula will actually calculate the recovered based on the day of the positive. 11 days later, they're recovered. And so instituting the formula, that's why you saw that big jump in recovered and you saw a decrease in active cases.
Yeah, and I don't know if you can see this at home, but I changed the slide back to the one where the task force calculates the recoveries and active cases. And we have the luxury of being able to go back in time and recalculate for every single date. And you can see that with very few exceptions, there's smooth transitions from day to day in the number of people recovered versus active cases. And this represents an algorithmic calculation also, like what the public health department's using, but with the luxury of not being locked into a particular day. This is what we said. We went back and we revised it here.
Okay. Thank you. And the last question is for Chris. Have you donated plasma? And if you haven't, will you?
I haven't. I just got out of quarantine on Friday, but sure, we'll do the plasma. I can see Annette licking her chops already.
We're ready, Chris. So, well, thank you for that. We appreciate it.
And
I
that's
know
all.
Dr. Ram appreciates convalescent plasma. So,
That's all the questions from Facebook. We appreciate it.
thank you. Are there any other questions? No. No further questions, so thank you all for joining us today. We will be back on Thursday at 5 o'clock with the mayor and the city manager, as well as the county judge and myself. Thank you again.